Hey guys, hey, let's get this party started. I have an update to do. I'm gonna try really hard not to become all like crazy emotional and just sad about it. Um, you know, I have been planning on getting the Vandover bypass put in um, since December 31st. Since December 31st, my doctor and I had talked and we had planned to do the lap band over my bypass. And I was just waiting for all my tests to come in to see if I was a really good candidate for it. You know, I had to get a barium swallow, I had to get an endoscopy, I had to get blood work, the whole gambit. I had to be, poked and prodded, and I had to go to a psychiatric eval, and I had to go to physical therapy. So, you know, they knew since December 31st I was going to be having this surgery. Like, we had talked about it, and all we were doing was just making sure that I was healthy enough and that my pouch wasn't stretched or, something crazy wasn't happening. So, in my view, the way I see it is, if you knew December 31st that you were giving somebody a lap band and the hospital doesn't perform lap bands anymore, and you know this, you're a doctor, you've been performing there for years, so you know that you haven't been performing one in over 2 years, he told me. Don't you think you would go in the back and just look and make sure that you had some? Maybe like the smallest chance in hell that maybe you don't have any because you don't order any because you don't use them. And now you have a patient who needs one, and maybe maybe you should look in your system and see whether or not there's one. So there is one. There's one. And the manufacturer's warranty is wearing out at the end of this month. I'm very frustrated because instead of just being like able to order something and it get there fast, they're telling me that they might not be able to get one in March at all, and hopefully sometime in April or May. So I'm very frustrated. He got my hopes up. I was preparing for it. I had my support system in place. I had everything that I needed to get done. I went and did everything I was supposed to in order to get this going. Matthew had his surgery. He was on the mend. I knew that I would be having surgery in March, so his mom would be here. We were like even keel. And then they called me today and they're like, well, they told me like last week or the week before that that the one that they had was a manufacturer, the warranty was off, and that they're not comfortable giving me one that is out of date. And I said, that's perfectly fine. I understand. Number one, if they got the band inside me and there was a hole in it, then there wouldn't be a backup. Number one, and the manufacturer warranty wouldn't replace it. So, on that level, yes, I understand 100%, and I understand that this is probably happening, for my it is happening for my safety, but it doesn't mean that I'm not really, really frustrated and really angry and hurt. I got off the phone with the bariatric coordinator, and she's like, we're trying to get it in as fast as possible, but there's only 2 lap band makers, and one of them is going out of business. That's how ineffectual the lap band is becoming. So, in one hand, I sit, I'm sorry, guys, I hate being so emotional, I can't help myself. In one hand, I see this being the less evasive surgery and the less evasive choice for me, and I know that I can make it work. As long as it doesn't, there's not a complication, from it. I can make this work. I have that kind of motivation. I have that kind of dedication. I have that kind of willpower to make the lap band work for me. I know I can. But the simple fact of it is that, they're pushing the D switch for me because I'm so heavy. And it's very, very, very frustrating because I don't want that right now. Like, the D switch to me is It's too evasive. There's too much malabsorption. It's not what I'm ready for. I'm not ready for that. That is the last resort for me. That is the end all be all. If I can't win this war with my weight through the gastric bypass, and if I can't win the war with my weight through the lap band, then that is the last step. You know, when I think about going back, anywhere near 400 or even 500 pounds, like, my heart breaks, my heart aches, and I hate being so emotional about it, and I'm really sorry. I know, people don't sign up for the big sob stories, but you know what? This is my freaking journey. And it's not always fun, and it's not always reviews, and it's not always like I'm having a great day. It's not. Because today I'm not having a very good day. I've had so many people just tell me, well, if you would just diet and exercise, what the hell do you think I've been doing? Like, what do you think I've been doing all this time? I'm 18 months out at the end of this year. Like, what do you think I'm doing? Do you think I'm eating pasta? Do you think I'm eating bread? Do you think I'm eating potatoes and rice? I wouldn't put that stuff in my mouth if you paid me. It's not from my lack of trying. I'm not saying I'm perfect, but I'd like you to show me somebody who is. But I certainly don't deserve to stay 320 pounds, and I certainly don't deserve to go back up to 5. So, my heart aches today because I was just really ready for this part of my journey to get there. I was really ready and excited and happy, and I was like, this is going to give me what I need. This is going to be the final tool to give me what I need to finish getting this weight off so we can have kids. Everybody and their grandma's having kids right now, and I'm like 36 years old and I don't have any. And it's frustrating. It's frustrating, that people can have kids who don't even want them, and we just want one. But I can't. I promised I would always be super real with you guys. I promised. And today is not a very good Nirvana day. And I can't make you laugh, and I can't make you smile today, and I'm sorry. But I'm having a rough time today. And I just wanted this over with. And I just wanted to feel better. But I don't. So I wanted to update you guys that I probably won't be having my surgery until like the end of April or maybe May. And I know that it's going to be fine. In the back of my head, I know that, these things happen for a reason, and you're supposed to have the surgery when you're supposed to have the surgery, and, if they put a faulty band in me or something, that it would have been something horrible. But that doesn't make me feel any better in the moment. In hindsight, probably. But in the moment, I feel like crap. I feel like crap. I'm just tired. I'm tired of being over 300 pounds. I'm tired of it. And I know I've come super, super far, and I know that, a lot of people are just like, you should be happy with the 200 pounds that you've lost. And I'm like, I'm very happy that I'm no longer 500 pounds, but if I don't do something, if I don't figure out another way to keep losing, then I'm going to go right back where I started. And gastric bypass patients can do that. I might not shoot to 500, but I can certainly go back up 300, 400, and more. I don't want to be in a wheelchair ever again. I don't want to have my mobility taken from me. I don't want it. And I have enough problems with my hips and my feet and my ankles and my knees, that I can, in my head, I see that wheelchair always ready. And I don't want that for me. Alright, guys, I'm sorry. I don't know if I'll upload this or not. But I want to tell you that I love your faces, and even when you guys have bad days, I do too. And I'll talk to you soon.